days, but I've had so many conflicts and I didn't want to miss another week because it's been like a month. So I've been out of town for 2 weeks and I can't go live tomorrow. And I think next Tuesday I have something too. So we just figured better just hop on live and get the live done and see if there's any questions. Maybe nobody's noticed that I haven't been live. Maybe they have. But welcome to the live. And here's where we do a Q&A. For those of you that don't know me, I am a traditionally trained OBGYN. I am a medical doctor, but not your doctor. And we're really not allowed to give any medical advice. So I'm hopping on here to see if I can answer any questions. I'm also simultaneously live on YouTube, so we'll try to monitor both feeds. But usually I come on live here for about 30-ish minutes, depending on the battery life. To see if there's anything that I can do to help you guys answer questions. We're here to advocate for you, maybe help you like what to ask for, and also to educate you. I've gotten a lot of questions lately about testosterone. It's been in the news like crazy because of the recent FDA hearing. Some of my colleagues were amazing speakers in front of the FDA trying to talk about why is there this discrepancy for men and women. So men don't even have to have an abnormal testosterone level. It can just be in the low end of normal and they can have 5 or 6 symptoms, but women have to be postmenopausal, low libido, and they say that the levels don't really matter. So, and even if we do fit the bill for women to take testosterone, basically there's no FDA approved testosterone for women, so it has to be compounded. It's not generally affordable, or you have to try to figure out how to take 100th of the dose for men. So lots of nuances, but I'm really hoping that because of that hearing, that maybe there will be an FDA approved testosterone for women, hoping so. But I am happy to answer questions. People are still answering or joining in, but now Blue Crush Mama, you win the you win the prize for the first question. Okay, can you get T in any state? That's really an interesting question because testosterone is actually regulated like a narcotic. And so I believe it's a federal level if it's regulated. We have to have a DEA number, and they've just recently changed. So DEA number is a number that's assigned to just me to prescribe narcotics. I don't prescribe narcotics anymore since I don't operate, but anything that's a regulated substance. So then it identifies the prescriber. And so in order to have that, not only do you have to pay a certain amount of fee, it's like $800 every 2 years. You also now have to do certain narcotic specific education. So as far as is it available in any state, it should be, because it shouldn't be a state level thing. It should be a federal level thing. So the forms of testosterone that are currently commercially available for men is a topical gel, is an injection. For men, there are some oral forms that are newer on the market. Those are probably not the best for women because I don't know how you take 1/100th of a tablet. For women, we do give testosterone compounded. So either in a topical gel that you put on your leg or in something called a troche, which is it's not really a lozenge, but for explaining it, it's like a lozenge. You put it under your tongue and it melts. When it melts, it goes into your blood vessels under your tongue, and that's how it gets to your system. So it doesn't go through your gut. It doesn't go through your liver that way. You can also do injections. Sometimes those are available at normal pharmacies. Sometimes you have to get those compounded. And some patients also get pellets, which are super compressed testosterone that's compounded and it's surgically inserted into your buttocks really every 3 to 4 months. But then they put all of it in one. So some people get really high levels with that. So how to find a provider that subscribes? That's a really great question, Blue Cross Mama. I mean, the first thing you want to do is try to find a provider who is knowledgeable about hormones. There's 2 different kind of schools of thought. There's a certified menopause practitioner, which I am one. It's a traditional certification. So you might be an OBGYN or family practice doctor, but you at least have extra information and training on menopause so you're not afraid to prescribe. I still hear of prescribers that tell their patients no, even though they have indications. So that's one way. They have a directory, menopause.org. The other way is if you have someone who has integrative or functional medicine or menopause training. A4M is an organization that, we're going next month to educate doctors in Boston. And so usually they have 3 or 4 programs throughout the year, like a weekend conference that a doctor can go to. They do have a fellowship and a board certification. So that's another. And they also have a directory, the number 4m.org, and they have a provider directory. So those are some options where you can do. And then also kind of vetting their social media, whether or not they talk about it or not. So those are the website, menopause.org. That's traditional. They're probably not going to get do testing. Maybe they would. It seems like that they're warming up to that idea. And a4m.org. Okay. Brenda Faith over fear. I don't like gels or creams or injections. I would rather pilots or patches. They release it slowly. So there is no testosterone patch. There was a lot of data on studies on that, and it never came to market in the US. It might be available in Europe. I'm not really sure, and I would love that option for testosterone. I agree. But there is no commercially available, and I don't think anybody makes a testosterone patch. So you have to either do a gel or an injection or a troche. Okay. Purple Heart, estradiol gel 0.5 is equal to the patch of 0.025. No, I don't think so. And they're apples and oranges because the estradiol gel 0.5, it depends on the half-life, it depends on the concentration, and the 0.025 patch is a lot lower. I don't think that you can routinely say that the patch is double strength of the gel. It's a lot more complicated than that. Not a famous person. I've had fatigue ever since hysterectomy, left ovaries. Can testosterone help with my energy? So people who have their uterus removed still can have hormone issues, even if you have your ovaries left. And the only way to find out for you is to do blood testing. Yes, it could be testosterone. It also could be that you are low in progesterone, or maybe your estrogen is stopped. So that might be a lot of reasons why, even though you don't have a uterus and you don't have a period, it's going to be very difficult for you to understand when you are menopausal, because the definition of menopause is 1 year without a period. Jennifer Jen, my doctor will not give me hormones since I had a melanoma 30 years ago. Well, I can tell you that I have had several patients with melanoma who are safely taking hormones. Yes, it is an estrogen sensitive cancer. That is true. But you had one 30 years ago and you haven't had a recurrence. That's a pretty good track record. So if your symptoms are really bothersome and you're wanting to take hormones, you might want to consider a second opinion. Who you suggest to test hormones? Can I send it to an online doctor? So I know there are lots of companies that are popping out with online telemedicine providers for hormone. And so some of them are very good options for people like you that cannot find a provider. So just vet them. Are they a nurse practitioner, PA, MD? What is their training? Who's the supervising? So there are some. I know MIDI, I think, is one. Alloy. Gosh, I'm trying to remember the one that my friend is working for her. There's lots of them popping up. I don't think the online problem is as much of a concern as what was that person's training. So yeah, if that's an option for you, and especially being online is so much more, convenient. If you can't find a provider in your geographic area, but you can get one at the other side of your state, that would be great. Debs, what kind of hormone test should be requested? So 99% of the time in my practice, I start with blood testing. And the reason is because there are certain things that you can only test in blood, like your thyroid, like your sugar, like your cholesterol. And we're going to do all of that because we do a full metabolic workup on our patients before prescribing hormones and just to make sure we get everything that's going on. You can test FSH and LH only in the blood as well. And those are pituitary hormones that are also involved in the regulation of hormones. But estradiol, progesterone, testosterone can be tested in the urine, in the blood finger prick, and also salivary testing. So we're usually starting with blood testing. Okay, Lala 6, I am postmenopausal with Hashimoto's. My cholesterol is high. How can I lower? So actually, I've had a couple great things, Lala 6. It seems like it's a little bit common. My cholesterol also jumped up. I have Hashimoto's. I'm not postmenopausal yet, but all of a sudden I've never had an issue. Plant sterols, 500 twice a day, or it's maybe 1,000 twice a day. But though that is a great thing that I have had a lot of patients have great results with that. And also I had recently a patient that took EGCG, which is the extract from green tea, 500 twice a day, dramatic improvement in her lipid levels. So those are kind of like two of the things that I would do. Also some good data with berberine. Okay, user 2401, what structure produces progesterone after ovulation? It's called the corpus luteum. And so you get a follicle with a little egg in it like this, and then it grows, and then ruptures, and that egg goes out, to go down the tubes. And this cyst goes like this and makes a corpus luteum cyst and starts producing progesterone. And when conception happens, the placenta doesn't develop till about week 13, and then that's when it starts producing progesterone. So the little corpus luteal cyst has to take over. Monogon, too low to get HRT at age 73. So that is definitely outside of the range that is optimal for starting hormone therapy. But let me clarify that within 10 years of your last period. So if you had your last period at 58, let's say, which is not that unusual, you're a little bit outside that 10-year window. So it would really depend on what your symptoms are, Monogon. I'd want to do a full cardiometabolic workup. I've had some very healthy late 60s, 70s women who are candidates for HRT, but it's a little bit nuanced, and so you have to want to make sure that you have a full evaluation. Okay.
Just want to let the people know on YouTube that we've got lots of free stuff, number one, and then number two, they can use the chat to ask questions. There's a few people on here.
For those of you on YouTube, make sure you can also post questions in the chat. Most of these questions are coming in from TikTok, so I'm answering them, but hop on and do that. And for all of you watching, whether you're on TikTok or whether you're on YouTube, my assistant just reminded me, we have tons of new free resources. We have a new download specifically about hormone testing. So I know that was one of the questions, and even Blue Crush Mama, you said you want testing, so maybe Alloy, and I don't know because I'm not really sure if they do testing or not. But I have a free download. There's a link in my bio. Where's the link on YouTube?
It's right under the video.
It's under the video, the link for the free hormone testing guide. We have a free mini course about hormones that's also available, and also a free download of so the course is free, the free course. We have a more detailed, in-depth course that is a nominal fee, but there is a free one. And then we also have a download of natural therapies for mood issues. So working on getting some of that stuff done. And if you guys haven't already subscribed to our free newsletter, that's also an option. Those links are going to be in my bio on TikTok. I think those are in the show notes and under the video in YouTube. So sign up for our free newsletter as well. So then you'll get a newsletter every week that's free. Ginger Smitty, what are your thoughts on a midwife who also treats menopausal women? You know what? I think the midwives, the ones that I have experience with, I worked in a practice with midwives for many years. They pay attention to what the patient is saying. They want to help the patients. They are interested in knowing what the issues are. So I would say that in my old practice, there are many midwives that I think would be fine for treating menopausal women. I think I understand what your question is getting at, though, is like if training in obstetrics, what is their training in menopause? So that's the second question. And so I know in my old practice, I have my former midwife colleagues, like when they get tired of delivering babies, because it's very hard to keep up that lifestyle, then they've gone on to maybe branch out into menopause. So that would be my bigger question, Ginger Smitty, is like, what is their training in menopause? Okay. User 24, okay, you're saying to take statins. That is definitely one way to treat cholesterol. There's an equivalency chart that shows the patch is much stronger. Again, it's micrograms, not milligrams. It's a completely different pharmacological dose. Okay, so one has a half-life, one is a matrix. So it's more efficient, but I think it's a little bit more complicated than that. Okay, Lisa, I'm appearing, feel like I'm dying. I know it's really, really frustrating. And so tell me, Lisa, in the comments, what are your biggest symptoms? And Julia, thank you for sharing the live. I'm so glad. Oh, Sarita, thank you for telling me how tan I look. I wore an SPF of 50 every single day on my vacation and even on my hands, but my hands are getting very, very brown. So I did wear a lot of sunscreen. Manda, TSH was 2.1, had a weird episode that sent me to the ER. TSH was 8.8. Could that cause this? So that's a really interesting, very quick switch of your TSH. So I really think there must be something going on with that. And I don't know what the time frame was from when it was 2.1 to 8.8, but 8.8, it is actually hypoactive. And so yes, the episode, you did exactly what the issue was, but that there's definitely something going on. Michaela, thank you for what you do. Oh, thank you. Thank you so much for saying that. Yeah, I mean, a lot of us have to spend more time and money getting this type of training than we did when I was at medical school. I certainly spent more time and money, maybe not time, but money, getting all my board certifications, additional board certifications than I did in my medical school. Okay, Kim K, musculoskeletal pain, 5-year LMP, HRT candidate. Okay, yes, within 10 years, Kim, so you're still in that age range. We're seeing more and more people present with the musculoskeletal frozen shoulder is a big one. Joint aches, joint swellings, memory. There's a lot of observational studies that are showing, and observational just means there's no placebo. They haven't tested it against something, but there's observational studies that do show that yes, memory is improved. Memory is so subjective, but also estrogen is anti-inflammatory, and when your estrogen's low, people get more inflammation. Okay, Joshua, thoughts on FDA note NDT classified as a biologic? Interesting, Joshua. To be honest, I saw that blurb and I did not really do a deep dive into that. So I don't think I'm completely up to date on what the FDA said about it, but I did see that there's going to be some changes with that. So, and since it's a biologic, NDT, for those of you that don't know, it's National Desiccated Thyroid. It comes from a pig. So it's not really human. It hasn't been FDA approved for years and it kind of grandfathered in. I have a lot of people that do really well on that. So it's going to be a shame if the FDA is going to try to get rid of that. That's what I'm saying. Amanda, about 3 weeks between those numbers. Okay, so that's a huge swing. So I hope you're getting someone to check your whole thyroid panel, your thyroid peroxidase antibodies, your TSI to make sure you also don't have Graves, and your free T3, free T4. Okay, do we have a question on YouTube?
Mind by Mind says, I'm one of your students at IPI. Thank you for your wonderful
Excellent.
teaching.
Oh, Mind by Mind. Thank you for, so what she's talking about is there's a whole track for mental health providers to learn more about precision medicine. So I absolutely love that because I feel like this is a really great area where people are coming in with mood issues and they often are hormonal. So thank you for saying that and thanks for hopping on the live. Okay, Blue Crush Mama, do hormone tests show if you're in full menopause? So that's a really great question. If you are somebody that has a period, the only way to diagnose you with menopause is 12 months without a period. If you are someone that has an IUD, that you've had your uterus removed, or you've had an endometrial ablation and you don't have a period, then we do have to use blood testing to tell if you're menopause. And it's 2 separate readings, 4 months apart, with an FSH above 40, higher, and a low estradiol. So the answer to your question is it depends on if you have a period or not, because the true definition is 12 months without a period. Another question on YouTube?
Yeah, from Marcy H. Have you found that LDL cholesterol improves when on BHRT, specifically transdermal estradiol and microdose of progesterone?
Yes, I have definitely seen, and I was just getting some slides ready for another lecture next month of a dramatic improvement, and the only thing we did was the EGCG and the hormone therapy. I think her cholesterol total went down about 100 points. Her LDL went down about 60 points. So yes, and her HDL didn't go down. So that's important. So yes, March or Marcy, yes, that is definitely an issue. Okay, so Purple Heart is switching from 0.5 milligram gel to patch. What milligram patch would you give? Okay, so are you talking about the daily dose that comes in this little packets? Because the other variable, Purple Heart, to let you know, is the half-life of the gel. So what that means is if you put a gel on and its half-life is 18 hours, that means at 18 hours, you still will have half as much circulating. If you put the gel on and it's a 10-hour half-life, then in 24 hours, it will be almost out of your system, or it should be out of your system. So there is a Divi gel that's 0.5, that's a 10-hour. So yes, I think if I was on the 0.5, I would probably start with either the 0.0375 or the 0.05 just to start. And everybody has different skin thickness. Everybody has dry skin, not dry skin. So they even absorb the gel and the patch differently. And that's why I'm saying it's just a little bit more nuanced with that. Okay, so Tara Tavares Hernand, I'm wondering if you're Tara or Tara. I'm Tara, not Tara. People always call me Tara though. So I'm wondering, you started progesterone cream while on my period and had to stop because my period didn't stop. Why? So normally when I prescribe progesterone cream, I usually have people stop it during their period for a couple of reasons. One, because physiologically we're trying to do what nature does. We're trying to mimic what your body should normally do, and you do not produce progesterone on your period. Two, when you give too much, and I don't know what your dose was, it can also suppress and make you have irregular bleeding. So I don't know if you started it then and then you just kept going, or maybe it was just a coincidence if you're saying that that was the first week that you started it. Olivia's mom, I had radioactive iodine, which put me to hypothyroid. Can I have Hashimoto's or is it impossible? You absolutely can. Absolutely. So some people with hyperthyroidism, the definition of Hashimoto's is having a TPO antibody that's positive. So you can still have hyperthyroid and have a TPO antibody that's positive and have radioactive iodine. You may still have antibodies positive. So it is possible. Okay. Let me go. Amanda, episode was sudden and extreme. HR increase. Okay, so that's interesting that you say that, Amanda, because your heart rate going up is actually more symptomatic of hyperthyroid than hypothyroid. So really want to get that checked out. Okay, Kim K, sounds like you are getting a lot of different aches and pains. So yeah, you should definitely get evaluated because then Blue Crush Mama is saying that her HRT helped her pain. So yeah, Amanda, I would have your GP check more than just your TSH. Ask for a free T3, free T4, a reverse T3, a TPO antibodies, a thyroglobulin antibody, and it sounds like a TSI antibody also should be something. Lisa, estrone is 669. That is very high. Some people shunt their estradiol to estrone. Estrone is predominantly the type of estrogen you make in menopause in your muscle and your fat. So that is a high. It can go up, estradiol goes up, and it sometimes goes up in perimenopause also. How do you schedule appointment, Marley? Okay, so I think there's a link in TikTok on inquiries about becoming a patient in my link tree. My office is in Akron, Ohio, and I have to follow the laws of Ohio because that's where my medical board is. So Ohio says that we have to see patients face to face for their first visit. I do have 2 nurse practitioners and a PA that work with me that are amazing. They have earlier appointments, so you would want to fill out an inquiry or go to Forum Health Akron, and there is a contact form for you to fill out. I am not really taking a lot of new patients right now because I seem to be spending a lot of time teaching other doctors and doing a lot of speaking. So there's not a lot of spots, but I also have the 3 other providers in my office as well. But thank you for asking. Okay, so gel packet. So Purple Heart. So yes, I think if you were taking the 0.5, I actually think you could start with I wouldn't start with the 0.025. I worry that would be too low. So I would start with the 0.0375 or the 0.05. Okay, somebody's problem. What do you suggest for mood swings? Okay, well, I love your name, but I'm wondering if you're perimenopause or postmenopause. But even without knowing that, There's some new data that and feedback that I'm getting from other providers that saffron is really helpful for moods. And Mind by Mind, you can hop in here and tell me if you're still on what you think is a good supplement for moods. We also will use L-theanine. Magnesium is great. I do like sometimes 5-HTP. It's not always the first thing that I look at, but what else for mood? God, my brain is so fried today. Magnesium is another good one. I know I already said that. Fish oil, also fish oil. Okay, estrone question above. I'm very concerned. Lisa, is there any chance that those labs were drawn around ovulation? Because that's the first thing, is that it does get very high around ovulation. I definitely want you to repeat that. I want you to also know what your estradiol is. So those are things. I've had people that have a high one and then a month later it's not high. So that would be the question. So yes, you should be concerned in the fact that you want to get more followed up, but maybe that it might just be a temporary thing. Okay, next question, Sophia Emilo. Dysmenorrhea is the medical term for painful periods or menstrual cramps. And so we usually break that down to primary and secondary. Primary being that we can't find a cause, you just have cramps. Secondary means there is a cause. Usually it's endometriosis is the most common cause. It could be something else. Charlie, what if your only TGA is positive? TGA. Help me out, Charlie, with the TGA. What do you mean by that? What are you abbreviating? Because that's not something that I'm familiar with at this point. Okay, Grillian Fute, any updates on HRT decreasing Alzheimer's for women with ApoE4? So yeah, the more copies of 4, the worse, right? I'm 3/4. I don't know that that particular study has been done on hormone therapy in ApoE4 people, but I can tell you there was a study on 400,000 women that they didn't know. We don't know if they had ApoE4 or not, but they were over 65 and they used hormone therapy. And the women that used a bioidentical form of estrogen and progesterone had a 58% reduction of Alzheimer's. So there's definitely a connection there that we have not actually found. Okay, so somebody's problem says menopause, no estrogen. Okay, so for moods, for you, ashwagandha could be another one that could help. 5-HTP could help, L-theanine, magnesium, but I would maybe try the saffron or the fish oil. Lisa, I got to go back to your question. Oh, postmenopause. Are you taking, your estrogen was really, really high. No estrogen. Okay. Oh, Lisa, you said post-menopause, but you didn't say whether or not you're taking estrogen. Oh, Black Widow, thank you. Vitamin D is good for mood. She wants me to stop your HRT. Okay, I see. So you're post-menopause on HRT, wondering if you're taking it orally, because oral estrogen can make you have very high levels. Also wondering how long you've not had a period. Sometimes if people haven't had a period for a long time, then they still produce estrogen.
Here, I'll let you read this one right here from Marcy H.
Okay. Period stopped for 7 months and came in month 8 before taking HRT meds. Doc told me to start taking it after period stopped, but we'll be taking HRT. Tell you to keep coming. Okay. So, you know what? That's a really good question. Will taking HRT prolong your age of menopause? And my initial answer is no, because we don't give a dose that's suppressive of the ovaries. We give a dose that is just working with your body. But I think having the proper amount of hormones puts your body in better condition. And I'm 56 and still had a period this year. I've only had 1 period this year, and I'm definitely winding down, but I really thought I would have been done because I've been skipping periods for 10 years. So my perimenopause has been extended. Instead of being like 3 years, it's really, really long. So I'm wondering, like, well, am I, because I'm doing better, and it's a good thing that I'm still having periods? I don't know. But the way that you're taking it, BHRT is not supposed to cause periods to coming, March. So that's the answer to your question. Blue Cross, so testing every 2 weeks to start. So if you're starting on the patch, I do think that you're going to get better results with blood testing than you would with the gel. The gel doesn't always show up in your blood. 2 weeks might be a little bit early to retest hormones, in my opinion. Megan, 93, newer research looking into DCS and double mastectomy and taking estrogen HRT. Thoughts? Oh, Megan, that's such a controversial topic. Look into the Best Friend's Guide to Breast Cancer, the Smart Woman's Guide to Breast Cancer by Dr. Jennifer Simmons. She's a colleague of mine. She's a breast cancer surgeon, and she's integrative now. So yeah, that's a really hard question that's not really answered easily, but what I can say is I do have some patients who have DCIS and can safely take hormone therapy. Somebody's probably thinking of changing my handle, everyone's problem. I love that. Oh, okay, thyroglobulin antibodies. Okay. Yes, that makes sense. Okay. TGA, I guess I use TG antibodies. So yeah. So Charlie, what if only your thyroglobulins and are positive? Okay, so Charlie, those can be positive with poor sleep and stress, and those are not thought to be the autoimmune provoking antibodies, but they can give you some significance that something is going on in your body and that you're having some inflammation. Texas talk 1 2 3 4. I'm headed to Texas in a couple weeks. Actually, I think I'm going to be there 3 different times this, maybe 2 more times this, to San Antonio. Okay, can you take hormones if you had surgically induced hysterectomy 10 years ago? I don't see why not at 55. You're still less than 60. So, Brilliant. I'm an ApoE3 and 4 also. Okay, good to know. Look that one up. Okay, it was the Women's Alzheimer's Translational Research Study. And I'm sorry I don't have that reference on the top of my head. It was something that I saw probably in Medscape, so maybe start there. And it was probably published, I'm going to guess, maybe 3 or 4 years ago. So maybe it's definitely within the last 5 or 6 years, Grillian. So look if you want to find that reference there. I don't have that offhand. Thoughts on DHEA supplement? I'm a huge fan of DHEA, and I've seen it make a huge difference with my patients. But dose is huge. You know, you can go and see DHEA 5 milligrams, 10 milligrams, 100 milligrams over the counter. And in Australia and Canada, it's regulated like a narcotic. So it's interesting. Somebody's problem. Thank you. That's so sweet of you to say that. I hope that you get the answers you're looking for. Organically, Ashley, is estradiol patches safe for endometriosis patients? So I have a history of endometriosis. I had 3 surgeries for that. I've been safely taking a patch for over 10 years. It really depends on the patient. And that's one of the reasons I like to look at how people metabolize estrogen. And I like to look at the levels, because if I give you too much estrogen and you still have endometriosis, that's not good. Blocked accounts, can an 80-year-old start on estradiol? So that's going to be a less common scenario if you're 80. I do have 2 colleagues, one who is an osteoporosis specialist and one who's a brain, like Alzheimer's specialist, and they both do start people that are older on estrogen. So I'm not going to say it can't be done. Osteoporosis and slight memory impairment. So check out Dr. Doug Lucas's information. He's an osteoporosis specialist. Okay, Purple, how often do we need an ultrasound if we have adenomyosis and started HRT 3 months ago? So there's really no clear indication to give you an ultrasound just for HRT for adenomyosis. Charlie, okay, terrible sleep. So we'll work on that and see if that's helpful. Susie, so I can't take progesterone pills or a combi patch because of rashes because of it. Have you tried, Susie, a compounded form of progesterone? Because they can make it a hypoallergenic filler. So that might be an option. All right, guys. Okay, one more question. What estrogen dose do we need if we already have osteoporosis and peri? So the dose that has been studied most often is 0.0375 for osteoporosis prevention. But I think that was an older study. Chi-Town Silver Girl, do you have to do a Dutch test to check how estrogen metabolism, or can you do it with a blood test? So metabolites is urine. Dutch Vibrant I think US Biotech and ZRT all do urine metabolites. Rhonda APRN, can I take progesterone for sleep even after hysterectomy? All of my patients after hysterectomy get progesterone. Okay, battery is on its last legs. Thank you for those of you that tuned in on Monday. Usually I am here tuned in on Tuesdays, so I'm glad that you guys hopped on even though it wasn't the normal day. If you haven't signed up for our free newsletter, click the link in my bio. If you haven't checked out our free download of our free guide for testing, hormone testing, check that out. Also follow me and hit subscribe on YouTube if you're not already following me. Here and on Instagram, Hormone Guru MD. Would love for you to follow me, give me some feedback. Great questions today, and I hope you guys are all getting the questions, the answers that you need. So next Tuesday, I think I'll be back, hoping. Yes, thank you for following me, and we will see you guys next time.